This is Lesson 5, How to Perform CPR on Adults and Children, a CPR Proficient Guide. The information provided on CPRoficient's website is for educational purposes only and should not be considered medical advice. While we strive to provide accurate and up-to-date information, CPRoficient makes no representations or warranties of any kind, express or implied, about the completeness, accuracy, reliability, suitability, or availability of the information, products, services, or related graphics contained on this website for any purpose. Any reliance you place on such information is therefore strictly at your own risk. When you identify a patient who you might believe to be in cardiac arrest, the first step is to check the environment. Check the environment for any hazards that may affect your safety or the patient's safety. Remember, your safety comes first, because if you get injured, how are you going to save your patient? A common acronym to remember environmental hazards is no fire, no wire, no gas, no glass, no drugs, no thugs. Although there are many other factors that may make an environment hazardous. After making sure that the environment is safe, you should check if your patient is actually unconscious and not just sleeping. First, tap the victim's shoulder and shout, "Are you okay?" If the patient shows any signs of understanding or wakes up, they are not unconscious. Next, trap squeeze, and then after that, perform a sternum rub. The last two steps test for pain stimuli. If your patient wakes up or shows any form of verbal or nonverbal stimulus, they are not in cardiac arrest. To be classified as unresponsive, they must not respond to even painful stimuli such as sternum rubs or pinches. Once you've successfully determined that your patient is unconscious, activate EMS. If someone comes to help you, or if you have a bystander, have that person call 911 and get you an AED. If you are alone and have a cell phone, call 911 and put the phone on speaker, and then get an AED if one is available. If you are alone and do not have a cell phone, leave the person to call 911 and get an AED if it's available, then return to the person as quickly as possible. Use the AED immediately, as it's the only way you can resuscitate a victim. Obtaining an AED and activating EMS precedes CPR. Remember, you're not a healthcare professional, and any type of healthcare professional or higher level of care will benefit you and your victim greatly. At this point, you would have determined that you have an unconscious patient, but you would not know if they're in cardiac arrest or not. You would also be on the line with 911. Do this for at least 5 seconds, but no more than 10. If the person is unresponsive and isn't breathing normally, or if they're gasping, then begin high-quality CPR. Next, check the pulse. If you do not feel a carotid pulse within 10 seconds, begin high-quality CPR, starting with chest compressions. Remember, these steps are only deemed true if you have determined that your patient is unresponsive. Now it's time to actually learn how you do CPR. This step is for adults. First, give 30 compressions. Ensure the person is lying on their back on a firm, flat surface. Then put the heels of one hand on the lower half of the breastbone and put the heel of your other hand on top of the first hand. Remember to compress at least 2 inches at a rate of 100 to 120 compressions per minute. This is at the beat of the song "Another One Bites the Dust" or "Baby Shark." Do not compress deeper than 2.4 inches in adults, as it may cause injuries. After each compression, allow for complete chest recoil. The act of determining where to compress on a patient's chest is known as landmarking. Please watch the following clip to determine how to landmark. First, kneel down next to your victim. Your knee should be close to their chest. Then, place one hand under their armpit and slide it up until it lies over the breastbone. Your palm should land square on the breastbone, and then place your other palm on top of it. This video shows you what part of your hand to use and where to place your hand. This next video will show you how to do one cycle of compressions. Doing chest compressions on children. This procedure changes slightly as children are smaller and more prone to receiving trauma from the procedure. To minimize risk, compress with one hand. 2 hands are still acceptable if it's required. Furthermore, compress around 1/3 of the depth of the chest, or 2 inches, whichever is less. This next clip shows you how to perform CPR on children with one hand. After administering 30 compressions, the next step is to give 2 rescue breaths. To provide effective breaths, open the victim's airway while using the appropriate technique. Use the head tilt chin lift technique, as mentioned in the previous lesson, to open the airway. If a head or neck injury is suspected, do a jaw thrust maneuver. Deliver each rescue breath over 1 second, and the victim's chest should rise with each breath. Avoid excessive ventilation. This is a video of the head tilt chin lift maneuver. This next video is of respirations being given to a dummy. Notice how deep breaths are taken between respirations to ensure that the victim receives adequate air. The procedure of giving rescue breath to children is the same, although since they are smaller and their lungs are smaller, they can be overinflated if filled by the volume of air stored in adult lungs. So, in children, instead of waiting for the chest to rise, wait for the victim's shoulder to rise. The final step is to continue the cycle of compressions and breaths. Continue giving 30 compressions and 2 breaths until help arrives or the person becomes responsive. In 2-person CPR, rescuers should change positions after every 2 minutes. For adults, in 2-person CPR the ratio does not change and stays at 30:2. For children, in 2-person CPR the ratio changes to 15 compressions and 2 rescue breaths. This means instead of 30 compressions, you're giving 15 compressions, but you are still keeping 2 rescue breaths. Thank you for completing Lesson 5 of CPRoficient CPR Guide. If you wish to learn how to resuscitate infants or neonates, please watch Lesson 6.